Hi, this is specifically for my 6th hour because of the fact that my video projector failed. So here are some of the explanation to the notes that you copied in class today. First of all, the fourth cranial bone that you are going to be required to know about is the temporal bone, and there are two of them. They form the parts and the sides of the cranium, and the thing that you need to note is that there is a suture here between the temporal bone and the parietal bone, and the way that it is pronounced is the squamosal suture. Okay, and you can see it in orange in the lower picture. There is a structure called the external auditory meatus. It's sometimes referred to as the opening. And this is the external auditory meatus here, where this arrow is. And it leads to the inner part of the ear. If you were to cut your ear off, there would be an opening into your skull from there. And some of you actually might have seen something like it when you were skinning the head of your cat, because sometimes you can see that in the cat as well. This is the mandibular fossa. Whoa, what just happened? I don't know what I just did. I just went too far, too fast. Okay, so this is the mandibular fossa, and what it does is it articulates with the mandible. The mandible is the jawbone, and articulates means that it joins or forms a joint with the mandible. So the fossa is this curved part here on the temporal bone. Anything that is called a fossa is considered to be a cup of some sort, or like a little indentation. And so this is a fossa here on the temporal bone. Now, there is a disorder called TMJ or TMD, and some of you experienced my TMJ today. There are several different characteristics that a person with TMJ may have, or symptoms, I guess would be the better word rather than characteristics. Um, and you can read those over. Some of you in my 6th hour did also had TMJ. And so you maybe have experienced these before. One thing that's interesting is tinnitus that's ringing in the ear. Some of you may have had that without even having TMJ. Now, this is not working on the uh, PDF, because this is actually an animation on this page. So if you look for normal TMJ function animation or something like that online, you'll be able to find it. I'll try to find it for you and post it on Edmodo too. Next structure is the mastoid process, and we always refer to these processes or processes with the name of the bone that they are a part of. So the mastoid process of the temporal bone, mastoid process of the temporal bone, that is an attachment for neck muscles. And there is a muscle that runs along the side of your neck called the sternocleidomastoid, and it actually goes from your sternum all the way up to your mastoid process. So if you kind of put your hands on the sides of your neck, kind of below the ear where the mastoid process is, and then bend your head from side to side or forward a little bit, you might feel the long band that is the sternocleidomastoid. There's also a process called the styloid process, and this one is rather easy to identify simply because it is a pointy structure, and it is an attachment for tongue muscles. And if you look at it, it is directly behind the mouth, and so that makes sense that it would be an attachment for tongue muscles. Last is the zygomatic process. We call it the zygomatic process of the temporal bone, and it extends anteriorly from the temporal bone, and it joins with the zygomatic bone, which is this orangish one, and it forms the cheek prominence. And here are the pictures that you had to put on. Next is the sphenoid bone.